Utilization management is a set of techniques used to control healthcare costs in a hospital system. By looking for medical necessity, we are looking to ensure that the patient is placed in the right status in the hospital setting. Some of the benefits of a utilization management program would be ensuring that the right care is occurring at the right time, in the right place. And that's where we focus on the actual admission order, ensuring that there's the appropriate admission order, that it's correct, and that the medical documentation actually supports that. So the cost benefits of having a utilization management program is to ensure that it will greatly decrease the risk of a denial. So ensuring that the care that is received, there's actually reimbursement given for that care. Two direct impacts a UR program has on denials. One involves performing the reviews at the point of entry into the hospital and concurrently throughout the course of the hospital patient's stay. The second would be the utilization of a physician advisor. In the event the patient does not meet criteria for admission, be it inpatient or observation, then you would rely on a physician advisor support to review that case and then determine whether or not medical necessity actually meets the criteria at hand. We definitely want to ensure that we have reviewers at every entry point into the hospital, whether it is in the emergency department, if you have a surgery center for same-day surgeries, to be able to capture those and do the reviews early on in the process. The benefit of starting the UR process early in the admission is astronomical. You really want to be able to start the review process early. One, so that you ensure that you have an appropriate order, that the documentation actually matches for medical necessity, and if there is the potential for a concurrent denial, you have an opportunity to make corrections while the patient is hospitalized. In addition to the use of a physician advisor, sometimes they're utilized for peer-to-peer reviews. If a patient has been admitted into the hospital and the payers determine that the care should not be received at that level, what we call a concurrent denial will occur. You then have an opportunity to utilize your physician advisor to discuss that care with the payer in hopes of overturning that while the patient is hospitalized. The best defense is ensuring that there is consistent front-end reviews occurring and continuously through the hospital discharge. There is an uptick in short-stay inpatient denials in addition to long-stay observation denials, so it is also important that the review process begins early on to ensure the patient is in the appropriate status. Again, ensuring the right care is being performed at the right time. One thing that's important when we talk about denials is it's so much easier to overturn a denial while the patient is hospitalized, avoiding the missed opportunity to potentially add additional documentation that may have been missed. You want to ensure that you are getting credit for the care that is being received.